On the news at 1, Commissioner of Police FCT Command compensates families of deceased officers with welfare checks. FCTA NCDC unveils health security report. And Yanya Indigenous Group seeks ministerial intervention to probe alleged irregularities in resettlement allocation.
Hello there, good afternoon, and thank you for joining us on the news desk of NTA Channel 5 Abuja at 1. My name is Tessio Mary with the details. The FCT Police Command has put smiles on the faces of 39 next of kins, beneficiaries, and families of fallen police officers serving under the command. This is following the Inspector General of Police pledge on assumption of office to prioritize welfare of officers and men of the force. Onotu Yakubu brings us details.
Affected but not dejected. Emmanuel Otilo is one of the next of kins of operatives of the FCT Police Command who either have paid the supreme price in the line of duty or officers who had permanent disabilities resulting from workplace accident, amongst others. 39 of the beneficiaries were presented with the checks amounting to about 37.3 million naira.
We are trying our best, at least we try to remember us, because it's not easy. Yes, to thank the Inspector General of Police for remembering us and also wanting to do more and reach out to everyone.
God bless you. I'm very happy. I'm very appreciate you, Inspector General of Police. May God protect him and guide him.
I want to thank God for as many as have put their heads together to make this program a progress. I really want to appreciate God that for them to have remembered us, God will also remember them and their family.
The presentation is a reflection of the Inspector General of Police Kayode Ebetokun's declaration of the first deep commitment to the welfare of police officers and continuous honor to the legacies of the fallen heroes to boost morale of officers at the course of their duties.
We thank for this kind of gesture coming timely, and is a motivation for the serving officers that somebody cares, that the IGP cares.
Part of the packages presented to the beneficiaries include insurance for police officers, group life insurance program, and the IGP family welfare package, amongst others. In Abuja, Onotu Yakubu, NTA News.
The United Nations Association of Africa, led by the founder and President General Sylvester Okeoba Okafor, launched Tobacco-Free Nigerian Schools Initiative, a UN SDGs program aimed at eliminating tobacco usage and smoke exposure in schools among youths. Sandra Akeme reports that the event is in observance of WHO 2025 World No Tobacco Day.
Initiative is a collaborative effort between UNAA and partners, focusing on creating awareness about the dangers of tobacco among students and youth. This initiative aligns with the World Health Organization's Framework Convention on Tobacco Control, which Nigeria is a signatory. In the sensitization workshop, the students, before a panel of judges, debated on the topic: social media influencers promoting nicotine products should face the same penalties as tobacco advertisers.
Should social media influencers promoting nicotine products face the same penalties as tobacco advertisers? I don't know what your answer is, but mine is definitely no. Nicotine is nicotine. Whether it comes from tobacco or you want to wrap it in sleek packaging, it is the same product. It targets the same audience. It fuels the same addiction. And you want to come and tell me that we should not punish the people that are spreading this misinformation and brainwashing our youth that it's good? Come on.
It is wrong for the use of tobacco nicotine products, because you see that some of the companies advertise their products using a colorful packaging, to deceive a lot of people out there, making it look as if the product or the tobacco is good to the health. But UNAA is here to sensitize the students and the youths on the best way to go about it, not to be deceived.
So it's very, very important, this program. I'm very, very impressed to be part of this program today. And I'm telling all our youth to spread this news across the schools, churches, and everywhere.
Now, my message to the youth outside and those in secondary schools and those upcoming generation is they should stay away from tobacco, which is very dangerous to the health if you want to live a healthy life.
The association called on governments and relevant stakeholders not to relent on this sensitive issue, with the theme Unmasking the Appeal, exposing industry tactics on tobacco and nicotine products. In Abuja, Sandra Akemi, NTA.
The Federal Capital Territory Administration, in partnership with the Nigeria Center for Disease Control and Prevention, has officially disseminated the Joint External Evaluation and Report assessing FCT's health security capacity. The report highlights strength in immunization and surveillance and also reveals key areas needing improvement. Hakimat Aliu has the report.
Developed by the World Health Organization, the Joint External Evaluation (JEE) is a global health assessment tool used to measure a country's ability to prevent, detect, and respond to public health threats. For the first time, the Federal Capital Territory has undergone a full subnational JEE assessment, marking a significant milestone in Nigeria's health preparedness efforts.
JEE is an iterative process, which means you show interest, you detect your gaps, you recommend, and then you implement. So this has been adapted by the national to fill the health security gaps to mirror this global process.
According to the report, the FCT scored high in immunization coverage, vaccine access, and delivery. Senior Officer for International Health Regulations in SICAC, Iman, who presented the findings, said FCT Emergency Response Coordination. The Mandate Secretary, Health and Environmental Services Secretariat, Dr. Adedolapo Fashawe, to act on them.
We are strong in immunization and vaccination. So also you heard that in all the areas that you may think we are not doing very well, it's just a matter of, you can say FCT, between 1 to 5, we are 3 to 4, which is average, and I think it gives FCT a very good result.
Meanwhile, the FCT epidemiologist Wal Ademola and Primary Healthcare Board Secretary Dr. Rukaya Wamako both emphasized that early prevention through immunization remains a front in public health security.
Most of our diseases are vaccine preventable, and there have been efforts over the years, both from the national,
the time we get it right in FCT, we are getting it right across the nation. And then when you look at FCT, every ethnic group in Nigeria has a representative in FCT.
With the JEE findings now public, the FCT is expected to develop in Abuja. Hakimat Aliu, NTA News.
We're not done yet with health issues. This report takes a look at this very unpopular medical condition, which requires medical attention.
I hear people say their environment is spinning, or even they themselves. And what you just hear in the common language is, I feel dizzy, which is so vague. But do you know that feeling requires proper medical attention?
Grace Yaya once had vertigo but overcame it with medication. Narrating her story, Grace describes the experience as horrific.
Fit to stand or to attend to my clients. And then my personal activity, business was at stake. I couldn't help myself that much. Even when I want to bet, I'll begin to have fears of how I'm going to go about it. Fears of falling down, fears of injuring myself and all that. So
Vertigo, aside the sensation of dizziness, is accompanied by other symptoms like nausea, headache, and ringing in the ear, among others. A consultant surgeon, ear, nose, and throat with the National Hospital Abuja, Dr. Omezikam Mbanaso, speaks on vertigo and causative factors.
We have what we call peripheral vertigo. That has to do with vertigo arising from problems in the ear, the inner ear. Then we have central vertigo arising from problems that have to do with the brain. Right? Even though sometimes they could be interconnected, but they are described as distinct conditions. So yes, the brain is involved.
Consulting medical practitioners to identify the underlying causes is the best way to manage and treat the ailment. For Grace Yahaya, vertigo is one health condition she will never wish for her enemy. The condition, she says, reduces her confidence, increased her stress, caused her emotional distress, frustration, isolation, and fear of falling or losing balance. Dr. Ifoma Edibe, also an ear, nose, and throat specialist with the National Hospital Abuja, highlight the causes of vertigo and management strategy.
You see the doctor and we'll be able to tell, is it from the ear, is it from maybe metabolic reasons or something like diabetes. Even thyroid problems can also cause dizziness. If someone has low sugar, you will be dizzy and you almost some of them black out or pass out. Attention, if the blood
vertigo condition, the severity of ailment makes the difference. Vertigo condition, the severity of ailment, 15th of April.
You have